Hi, I'm Nicole Cutler, a licensed acupuncturist and holistic health advocate. Figuring out what your hepatitis C viral load means can be extremely confusing. One of the most common misconceptions among hepatitis C patients is that a higher viral load indicates a greater severity of their disease. This causes many people to incorrectly conclude that if their viral load is high, they are in much more serious trouble than if it was low. When you have hepatitis C, it doesn't just stay in the liver. It can also be found in your bloodstream. Viral load is the number of viral particles floating in the blood. These particles are copies of the virus's genetic material. Measured in viral particles in 1 milliliter of blood, a person with a viral load of between 200,000 to 1 million is considered to have a low viral load. A viral load between 1 and 5 million is considered medium. A viral load between 5 and 25 million is high, and a viral load above 25 million is considered to be very high. Numerous studies have shown that people with lower hepatitis C viral loads respond better to interferon therapy than those with higher viral loads. This leads some people to conclude that a higher viral load is equivalent to a more serious condition. However, it really just means that those with a high hepatitis C viral load may not be ideal candidates for interferon therapy. Viral load does not appear to correlate with a person's wellness. In fact, a person with a viral load below 200,000 may not be able to get out of bed because of their hepatitis C infection, while someone with a viral load of 10 million could feel fine. The only way for a physician to accurately determine the severity of liver disease is through a liver biopsy, or a similarly equivalent method. A liver biopsy looks to see how much liver damage actually exists. Although a viral load test is not a measure of liver disease severity, it is an important marker for several other reasons. The first is that a viral load test tells you whether you still have the virus, or if your body has cleared it. The second only applies to pregnant women. The chance of a pregnant woman passing the virus on to her child is very low, unless that pregnant woman has a high viral load. An expectant mother with a high viral load has a slightly greater chance of passing the virus on to her baby. The third is for those on interferon treatment. Viral load tests help a physician determine if the treatment is working and how long a person should continue taking it. In this context, viral load is probably most useful. When a physician evaluates your viral load to see if you are responding to interferon treatment, they look at this number in terms of logarithms. A 1 log change is equivalent to a 10-fold difference. Significant changes in viral load are a 2 log difference, or a 100-fold change. Differentiating between a 1 and 2 log change can be deceiving. Let me explain. A viral load of 800,000 that drops down to 400,000 might appear to be a big drop, but it's only changed by a factor of 2, which turns out to be a fraction of a 1 log change. However, a change from 800,000 to 8,000 would be significant, because that is a 100-fold change. In general, if a person's viral load has dropped 2 logs or more after 12 weeks of treatment, then there is a greater chance that their treatment will be successful. When used to evaluate the success of hepatitis C treatment, viral load is measured to see if the person achieved a sustained virologic response. If someone has achieved a sustained virologic response, it means that 6 months after their treatment has been completed, there is no more detectable hepatitis C virus in their blood. Hepatitis C viral load will normally fluctuate throughout the course of a week. In and of itself, viral load is not a reason for concern. It may sound like a good measure of how you are faring with hepatitis C, but outside of its use to monitor interferon treatment, viral load reveals very little about your liver or your overall health.